March of Dimes is leading the effort to impact birth equity across the nation, understanding and recognizing that it takes an entire community to have an impact. And that's where the collective impact efforts start to play a role.
We're so excited. This is a March of Dimes national effort, and we're just so proud to be hopefully the model city here in Houston, Texas.
We have to work on a lot of things at the same time. We need to improve outcomes in hospitals and with physicians. We need to make sure that other systemic challenges don't stand in the way of women being able to receive great care before and during and even after pregnancy.
I know how many women are served, and I know how much it means to women to get access to the kind of education that they need to have a healthy pregnancy and then to be a good mother once their child is born. March of Dimes does all of these things, and they do it better than anybody else. I was very motivated to try and see what I could do to be a part of the solution to this problem.
I think that historically we've really focused on the health of the newborn, and we've addressed prematurity, and we have a lot of services wrapped around the baby. I think it startled many of us to put our heads up and look to see that mom's health wasn't where we wanted it to be.
A lot of folks in Houston are surprised when they hear the statistics. We're a proud city. We do a lot of things really well. So when we hear that we have a problem of this magnitude in our city, folks really want to get organized and rally around it to help move the needle.
When they took Kira back to the OR and they opened her up, there were 3.5 liters of blood in her abdomen, from where she had been allowed to bleed internally for almost 10 hours. While our begs and our pleas fell on deaf ears. After telling me that everything would be fine, when those doors opened and closed behind my wife, that was the last time I saw her alive. Kira deserves so much better.
These challenges across the country are affecting almost every single community. Policy change is at the heart of what will make a big difference. That's why Charles and I spent time on the Hill.
We want to make sure that we understand local data, and that we utilize that data to impact evidence-driven policies.
This work that this organization is doing is generational defining work. Because this work, to send a loud, definitive message to this country that mothers and babies matter, is not only going to affect this generation, but generations yet born.